Prostate cancer is one of the tougher cancers urologically to take care of, not because we're not good at treating it, we are, but because there's a lot of different types of prostate cancer. Some cancers are very slow growing and indolent and don't cause much of a problem. Other cancers can be very aggressive and can ultimately be lethal. And so it's our job to try to sort out which cancers are which and guide patients accordingly.
Prostate's in a tricky location. It's in the pelvis, and it's deep in the pelvis, and it's under the bladder, and it's in front of the rectum, and it's sitting on top of nerves that travel to the male genitals, and so they become important in continence and control of urine and in sexual function. Because of its location, it presents difficulties with regards to side effects from therapies. Men need to understand that it is a really common disease that is absolutely treatable and curable. The earlier we detect it, the better we are at treating it.
There's actually been a lot of new developments with prostate cancer. For example, with biopsies. Rather than taking 12 random biopsies from the prostate, they can integrate an MRI so that they can guide the biopsy needles to the lesion, which makes the process easier and more accurate.
And the testing, it begins with two things. It begins with a blood test called PSA, and it begins with a physical examination called DRE, or digital rectal exam. And if either one of those two examinations are abnormal, we then sit down with patients and counsel on the possibility of proceeding with the next step.
In any stage, we have absolutely good options that can limit growth, that can cure, or at the very least control and manage.
So my advice for patients with prostate cancer is to have hope. There are many effective therapies. Oftentimes patients are going to live a long time and have great quality of life, even with prostate cancer.